doctor tonight. Well, we're going to be talking about your smile. And when you smile, what really shows? Well, your front teeth show, the uppers and the lowers, about from the beginning to, from the middle all the way to maybe about halfway back. Dr. Todd Shatkin is back to talk about your smile and those teeth and what they can do between new implants and cosmetic dentistry and all the procedures that could improve your smile in probably as little as 1 or 2 visits. So the Aesthetic Associates is where you're going to find Dr. Todd Shatkin and his great staff. So let's smile today and show everybody how great your smile can look.
Sounds good, Linda.
Yeah.
You know, I've been in practice almost 20 years, and it's just
I can't believe it's been that long.
Flew by, but
yeah.
You know, when I started in practice in 1989, I came from dental school in San Francisco and brought back some, at that time, very new procedures that really weren't being done in Western New York, especially the porcelain veneers. I think I was one of the first in the area doing veneers back in 1989. And it's just grown tremendously. Now you see it, you know, it's all over the place. Everybody's having cosmetic dentistry done now. But it's amazing how the dental field has changed.
It sure is.
You know, in 20 years. And now being able to replace missing teeth in one visit with mini implants and crowns and stabilizing loose dentures and all that stuff. It's very exciting to be involved in this profession.
And there are people who come to you who probably never thought they'd ever really see a big improvement in their mouth, and those folks make the most astounding pictures.
Yeah, I just finished a patient this morning who had big spaces between her teeth, and we put new crowns and closed up all those spaces, and she looked in the mirror and she started to cry.
I bet. Let's take a look at a before picture. Okay, now here's a typical picture of a missing tooth.
Yeah, this patient broke off their front lateral incisor under the gum line. It was a old root canal tooth, and it just deteriorated and it snapped off. And so we replaced it with an implant and a new crown. And here's a side view of that.
Oh, so it's definitely going to show when he smiles.
Oh yeah.
Wow.
Here it is, all finished.
Wow. That's an improvement. As one tooth, that's such an improvement.
Yeah.
Amazing.
And there's a frontal view photo of it too here.
Wow, look at that. He looks like he's always had beautiful teeth. I mean, just that one tooth, look at the difference. That's an incredible difference.
Right.
Wow.
Well, it's amazing how people walk around sometimes with missing teeth or spaces between their teeth or broken fillings or broken teeth. And a lot of it has to do with fear of going to the dentist, unfortunately. And I want people to understand that the procedures we do are not painful. And we make it very comfortable for them. We have, if somebody's really, really out of control, so anxious and nervous, we do have IV sedation. Dr. Rose Birkin will come in and sedate you, and she's an MD anesthesiologist. So if you need to be sedated, we can give you an IV and sedate you. But 99% of the time, these procedures are simple. They're painless. There's nothing to worry about.
Okay, we have another before, which we'd like to show you. All right, now here it looks like the 2 front teeth.
Just a big space.
Big space between them.
The bite changed and the teeth shifted to the side, and very, you know, not real attractive having that type of a space between the teeth, plus some chipping on the front teeth. Now this was an enormously large space. We did veneers on the patient's teeth, and we closed up the spaces, and we did the 6 front teeth. So we took that big space in the middle and we divided it among 6 teeth. So we made the front teeth closer, and then we brought the side ones in, and I think we've got
That's amazing.
That's it, so.
Wow. That's incredible.
And those are all porcelain veneers.
And that person went a whole lifetime with probably avoiding smiling and take a look.
See how nice it, looks nice.
Look at that natural smile. And I think sometimes people don't realize that if you're missing teeth, how that starts to change your jaw and change your face shape.
Yeah, for sure.
And you don't want to go around like that for too long.
Right. Interestingly, those patients are both gentlemen. And cosmetic dentistry is becoming very, very popular among men, as well as, it has been among women. But lately, the men are really getting interested in improving their smiles.
I would imagine that we're talking out to a lot of people who, and some of them have had not good teeth, for smiling all these years. And if they've never said anything to anybody, you may not think that doesn't bother them.
Right.
But I bet you if you were to talk to them about it, you'll find out that has bothered them for years. And they don't want to say anything about it. That's the perfect person to prove that you can change that.
And they don't smile as much when they're not happy with their smile, and so that reflects their personality too.
Right.
If you're not smiling or you're covering your mouth a lot, it reflects how you you
It
act.
certainly does. And right now we have so many people who are changing careers. They're finding that the doors are shutting in different places, but they may get an opportunity, or maybe you're doing something new like job searching.
Absolutely.
You really want to put your best foot forward, and you don't realize sometimes how just taking care of your dental health can make you look 20 years younger.
Absolutely.
And make you much more competitive for an
Yeah.
opportunity.
Even patients who have full dentures, when they have their dentures 8 or 10 years, they start to settle. Their lips, they lose their lip support, they get wrinkles, premature wrinkling, their chin and their nose get closer together, and they look older. And just having new dentures made with or without implants can bring 5, 10 years off their life.
Absolutely. So, by all means, get an appointment with Dr. Shatkin and say, look, this is my smile. I'm not happy with it.
Right.
What can I do? Sometimes it's as easy as a couple of veneers. It's skin, it's teeth brightening. Maybe it is an implant, whatever it is. This is that time to find out.
And don't be embarrassed. I mean, if your teeth are in really bad shape, I've seen it all. So people come in and say, I don't want to open my mouth for you, because it's okay. I mean, I'm not going to lecture you. I'm not going to, tell you what you did wrong. We're just going to figure out a way to fix it.
That's the best you can do. All right, everybody, you've seen the proof of the pudding. Now you want to get to the phone right now. This is what the Aesthetic Associates Center can do for you. Easily located at 2500 Kensington Avenue in Amherst. Go ahead and give them a call at 839-1700. Moms, make sure it's that last Mother's Day picture where you're afraid to smile. Get out there and really have a great summer and show off those pearly whites. 839-1700 with the Aesthetic Associates Center. And we're thrilled because this preceding segment and images used have been brought to you by the Aesthetic Associates Center.